loves, and welcome back to my channel. I'm glad to see all of you. If you're new here, my name is Kalia and I make vlogging content on day-to-day life and my life as a type 1 diabetic and just how I keep things real. So I had put out a poll on my YouTube channel and I had a 50-50 toss-up between people wanting to see about a deep clean of my apartment or to discuss perimenopause. I am still not feeling 110% from my weekend last weekend. I ended up with a pretty severe kidney infection. My symptoms weren't the usual kind of symptoms for a kidney infection, so it was a little odd. And I really didn't think anything was wrong until my blood sugars went up and wouldn't come down, which if you're diabetic, you know that means your body is fighting off something. And really honestly, if I had actually listened to my Oura ring on Friday was when it started telling me my biometrics were all off, that I was fighting something major. I probably could have avoided a trip to the emergency room, but all I was having was just this pain over the center of my spine and my lower back. It didn't seem like kidneys. I wasn't having any other issues other than just this weird back pain that was about the size of my fist. And so I just ignored it until my blood sugars wouldn't come down. So lo and behold, on Sunday, I went into the emergency room and my vital signs were hot garbage. I had a heart rate of like 125. I was running a temperature of 100.8. I was pretty sick. And so they did all the blood tests on me. Thankfully, there had been no damage to my kidneys. I got an IV antibiotic and was sent home with some pretty strong antibiotics that I am still taking. So long and short story is that because I'm still suffering a little bit from this kidney infection, my right kidney is the one that it feels like got the brunt of the issue. We're going to talk about perimenopause today because I just don't have it in me still to really do a big deep clean in my apartment. So I am going to put on some makeup and we're going to discuss perimenopause. And actually my story about my kidney infection kind of leads into perimenopause. Unfortunately, one thing that happens with perimenopause is that you become more susceptible to urinary tract infections. And so basically that is exactly what happened, is that I had a UTI and the antibiotics I was on didn't treat it right. And so that's how I ended up with a kidney infection. So hooray for that. Really, you do have to be careful with perimenopause. If you're already pretty susceptible to having bladder infections, I would highly suggest starting a supplement. I take cranberry supplements every day to try and help have a healthy bladder and just a healthy woman's system in general. I also take probiotics to support good bacteria growth. Those are all going to be very important for maintaining your health, especially as you're going through this time of your life. So perimenopause is just basically a time that all women and really people with ovaries end up going through, and you can go through perimenopause starting in your 30s. And one thing that I found out that I was not thrilled with is that perimenopause can last for years. So I basically just started noticing symptoms last fall. I believe it was. Yes, it was last fall. One of my first symptoms was just this uncontrollable rage that for whatever reason I just felt like took over. It was intense. I would never know where it came from. I feel like A lot of times nothing prompted it, or like the dumbest things prompted it. There was one day I just got super angry at my dogs for no reason. Like literally they were just existing. And that was kind of the day that I realized something was wrong. So I went and I spoke to my mom, who is a retired nurse, and she basically verified that she started going through perimenopause at roughly about my age. And if none of you know, I am 42 and I'll be turning 43 this August. So it was right after I turned 42 that I started noticing these symptoms. So I went to my OBGYN, and thankfully nobody dismissed my symptoms, but don't allow anybody to dismiss your symptoms. If you go to a doctor, preferably an OBGYN, and you tell them something's wrong, don't let them write you off, because these symptoms really do, they make you feel like you're crazy. And you're not. It's just your body having straight up hormonal stress. I mean, it's nuts. It feels nuts. Every month I hate getting close to my period, because the week before, that wonderful PMS week, it just all goes bonkers for me. It's just this huge dumpster fire, and I really don't know what to do with myself. So I spoke to my OBGYN, and she referred me to a, not really psychologist, but not really a therapist, maybe a psychologist, who basically specializes in women's health and the hormones. And what I have is PMDD, perimenopausal depression disorder. I was having massive ups and downs the week before my period. There was anger, there was sadness, there was thoughts that shouldn't be there. And so I went and got help. And yes, she did put me on an antidepressant. It's not a very high dose, but it's enough that it takes away the rage, the sad thoughts. It just helps me feel a little more me. So aside from the antidepressant, we also just talked about some of my other symptoms. My periods are still very regular, oddly enough. So I'm not really getting close to the actual menopause stage. So, which tells me that peri is going to drag itself out on me for a little while. Which I'm not thrilled about, but it's just a part of life. So it's just going to be something that I'm going to have to learn to combat. And I feel like every month there's like some new symptom that I'm learning about, or I don't know, just something that I'm having to discover about it. And it has been quite a trial. One of the weirdest symptoms I can tell you that I have discovered is an inner ear itch. It is literally the worst. And for some of you that may or may not know, I am a nurse, and there are days that I have to scrub into a sterile environment. And when I'm at that scrub table with the doctor, I am sterile, and I can't touch anything else other than my table and the equipment that we have. So when I get that dreaded inner ear itch, oh my gosh, I mean, there's nothing I can do about it. I can't just reach up and scratch my ear. I would break all sterility, and I can't ask anybody else to scratch my ear because one, ew, and two, I have to wear a hat at work all day. So it can be, yeah, pretty intense sometimes. I've actually kept to keeping some syringes on my table, and I can kind of get into my ear with the tip of the syringe and then just throw it away and still actually stay sterile at work. So that's helped me in some of the more rough times of trying to figure out how else to combat these symptoms. Other symptoms that I've noticed, migraines. I've gotten a huge increase in migraines. And again, that's something my mom said that she got when she started peri as well. So yeah, that's been something that's been a little new and different that I've also had to combat. Because of my seizures, I have a neurologist on staff already, thankfully, and he's very good about listening to me and my needs. And so we've had to do a couple of trial and errors with some medications. And now I take a nightly migraine medication to try and keep them away, and also a breakthrough emergency medication, basically, so that hopefully I can just continue to function day in and day out. Let's see. Being a type 1 diabetic has been a bit difficult, to say the least, around this time period, because my blood sugars, I'm having to basically relearn how to manage them. Again, anyone who's a type 1 diabetic, they know hormones just wreck your blood sugars a lot of the times. And so that's a whole thing that you have to manage. And now I'm having to relearn how to manage it. And it's extremely annoying. So basically the week before my period starts, my blood sugars go up really high, and I have to increase my insulin intake. I also have to modify my diet quite a bit, mostly because if I eat a lot of sweets or carbs around that time of the month, my blood sugars will just be out of control. And there's very little that I can actually do about it. So I try to stick to kind of more of a higher protein, lower carb diet about that time of month. And of course, upping my insulin requirements as well, because overall that just makes things a bit more manageable for me. I did also find out that perimenopause can affect other chronic conditions besides just diabetes. I am also an epileptic, and this past January, I had my first seizure in over 8 years. Don't worry about this red lip. This is just a lip stain. It'll be coming off. I realize it probably doesn't look that great. So I had my first seizure in a very, very long time. It was a surprise. Neither my boyfriend or I really knew what to do about it. I had called my neurologist after that happened, so I also needed to make some medication adjustments to be able to handle, again, these hormonal changes. Unfortunately, because of one of the seizure medications that I'm on, hormone replacement therapy is not going to be an option for me. High amounts of estrogen in HRT and even progesterone in HRT can cause the medications that I'm on, it can cause their efficiency to be cut in half. And so, especially since I'd had a seizure in January, that's kind of less than ideal. So basically now I have to figure out how to deal with everything without hormone replacement therapy. And so that's proving to be quite a bit of a challenge too. And I'm really not trying to say all of this to scare everybody. Everybody's journey with this is going to be very different. I just, happen to have a couple of chronic conditions that are affecting my ability to be able to just do traditional types of care for perimenopause. So we tried a birth control to see if maybe just completely taking away my periods would help the symptoms. It was a very, very low dose progesterone based birth control, and which my doctor was okay with. Progesterone is a little safer than estrogen, but I couldn't handle the side effects. I was basically just feeling like I was in PMS mode all the time. Not necessarily the emotions, but more the physical side effects of it. So I stopped taking it. I was kind of bummed. I was hoping to not have to have periods anymore. It would have been pretty awesome, but it's just not in the cards for me. So kind of back to square one of just doing medication management, basically. I am having to, just take my epilepsy meds, my new ones, not new ones, but higher dosages, and making sure I stay up with my migraine medicine. I'm doing well with that, not missing any doses. And then, of course, taking all of my other medications, adjusting my insulin as needed, taking my antidepressant, and just, it's kind of a struggle. But I have learned a lot of new things. I have, first of all, learned that I am not alone. A lot of women have a worse journey about this than I have. I'm very lucky that I have doctors that listen to me and take my concerns very seriously. That has meant the world to me. If you find that you feel like you are experiencing symptoms like this, or you suspect that you're starting to go into perimenopause, please bring it up to your physician. But like I said, don't allow anyone to dismiss your symptoms. They are real, they are valid. Don't allow anyone to just kind of wave you off and tell you you're fine or that you're crazy or something stupid like that. Just advocate for yourself. And I say that as a nurse and as someone who has been a patient. Please advocate for yourself. Make sure that you are being heard, that people are understanding what you're saying, and that you need to have care and to be taken seriously. It's all extremely important. Because you should be. We all have that right as patients to be taken seriously and taken care of by our providers and our care team. My specialty is certainly not women's health, but I highly encourage you to see a women's health specialist and a therapist. I've really been considering signing up for therapy ever since all of this started, because I do still find that there are days that I can break down and cry a little more easily. Now, granted, it's been kind of a rough year for me already because of everything that I've been through with the death of my grandma and having a seizure and all that kind of stuff. It's been kind of rough. So it's all stuff that I am having to learn and explore and go through day to day. It's definitely not easy, but I encourage you to talk to your doctor, talk to your friends. You guys can also use my comment section as a place to bond and talk. I think, even if it's all people online, it helps to be heard. It really does. And so I'm going to encourage that of all of you, my followers, to please reach out to each other and validate each other going through something like this. Because it's hard, especially if you don't feel heard or taken seriously. So please, please, please do advocate for yourself. Super important. You know, contour still scares me. I try so hard, and I still feel like contour is still just utterly terrifying to me, and I don't know why. Anyways, there. So everybody has their own weird symptoms that they have to combat when going through peri. Some of them are just honestly hilarious. I'm trying to think of any other weird symptoms that I may have had. I get that weird inner ear itch. And it's so funny when I mention it too, and other women start going, oh my God, is that really part of perimenopause? Yes, yes it is. This just weird inner ear itch. It feels like somebody's tickling you in your ear with a feather, and you just can't get it to go away, no matter how much you scratch your ear. Increased UTIs have definitely, like I said, been something that I have been fussing with. The changes to my chronic health conditions also. So anybody with chronic health conditions, please be prepared for them to possibly flare up. What are some of the other weirder symptoms? I mean, obviously the rage, which was basically my first kicker into realizing something was wrong, because I am not an angry person. I really am not. It takes a lot to push me into the rage that I was feeling. Some of the symptoms are just funny. I know that, some women have said that their bodies have changed for the better. My best friend has said that. She feels as though there are some things about her body that have gotten better compared to before perimenopause. What are some of the other symptoms? I know eventually my period will start to become different. It won't come as frequently. It won't be on schedule or anything like that. But that'll start probably happening closer to when I hit menopause. So probably in the next few years, or when I'm getting closer to my 50s. But my mom did have a hysterectomy in her mid-40s, and I will probably end up with one too. I'm not mad about it. I never had kids. I'm not upset about that either. I like my child-free life. I enjoy being able to just do whatever it is that I feel like doing. I do have responsibilities. You all have met our pets. So you all know that we don't just live this lifestyle of gallivanting off to wherever we want. As fun as that is, I do sometimes miss my travel nurse days where it was just me, my cat, and my dog, and we would do just that. We'd gallivant off anywhere. Anyway, a little off topic, but I can't really think of any other weird symptoms that I've personally experienced, but I know that there are plenty of them out there. And I know some of them are like changes in your hair, changes in like even your skin tone, or just all around. I almost think that if you can think about it, it could potentially be a perimenopause symptom, which is just weird. I mean, it really is. It feels like just the most random stuff. And I wish I could explain it to people better, just what that feeling is. But you really don't understand it until you have actually experienced it. And then then you just kind of go, oh, that's what this is. I didn't really know much about peri until I started going through it. I was surprised. I really thought there was just regular and then menopause, and that was kind of it. So I did not expect to start having changes. And then I think what it was that I stumbled on somebody's TikTok and they were talking about perimenopause. And just the symptoms that they were listing just kind of made me go, oh, that sounds a lot like me. And so that's when I brought it up to my mom, and she confirmed. I wish that I had been a little more prepared for it. Maybe I wouldn't have gone through so many months of just questioning my sanity before I figured out what was actually going on. But I'm hoping that maybe this video will help some of you realize what could potentially be going on in your bodies, or if you are getting close to that age, or you know roughly when your mother started going through peri, maybe then you will be a little more prepared. And so that's kind of my hope for you, that I can just provide some comfort and letting you know that you are normal. This isn't some sort of, just emotional spat or whatever that you're going through. It's very valid. So I do hope that this video has helped and you can feel comfortable talking to each other, asking me questions, or just researching on your own, and maybe I've given you some knowledge or at least some stepping stones to get there. All right, loves, I'm gonna do my hair and we'll finish up this video. Okay, loves, thanks for letting me gab at you. If you have any questions, please feel free to drop a comment. I'll be happy to answer them. Please also lift each other up and talk to each other. Sometimes some people's experiences are far different than yours, but you may also find that you have a lot of things in common, especially dealing with this kind of stuff. So I will talk to all of you next week, and we'll see about getting that deep cleaning video done. And I hope that all of you have a great week ahead. Please love yourselves, stay hydrated, and stay feral. Bye.